The skull. The first thing we're going to learn about the skull is about the immovable joints that you find between bones within the skull. These joints are called sutures. The first suture that we're going to learn is found on the superior side of the skull. The coronal suture is located right here. The second suture is found also on the superior of the skull. Here is our sagittal suture. The third suture is found on the lateral side of the skull. This suture is called the squamosal suture. The last suture is found on the posterior of the skull. This is the lambdoidal suture. The frontal bone. The frontal bone is this large bone that we find on the anterior of the skull. One structure that we need to know with the frontal bone is this structure here called the superior orbital margin. The superior orbital margin makes up the superior part of all of the eye sockets. On the frontal bone, you are also to know the frontal sinus. The frontal sinus cannot be seen on this skull. The parietal bone. We have two parietal bones, a left parietal bone and a right parietal bone. These bones make up the majority of the superior part of the skull. On the lateral side of the skull, we will find the temporal bone. And again, we have a left and we have a right temporal bone. The first structure that we're going to see with the temporal bone is this structure here. This is the external auditory meatus. A meatus is a tube-like opening. In the case of the external auditory meatus, it is the tube-like opening that goes into the structures of the ear, auditory, and it's on the outside of the skull, so it's external. Posterior to the external auditory meatus, you see this portion of bone that sticks out. Any portion of bone that sticks out is called a process. This particular process is called the mastoid process. You will see this portion of bone that sticks out in a sharp, pointy-like fashion. This is called the styloid process. If we turn the skull so that we look at the inferior of the skull, you will see between the mastoid process and the styloid process, there is an opening. This opening is called the stylomastoid foramen. Any opening or hole in the skull is called a foramen. The temporal bone forms a joint with this bone called the mandible. This particular joint is called the temporomandibular joint. This joint is not a suture, it is actually a synovial joint. The part of the temporal bone that forms the joint with the mandible is called the mandibular fossa. A fossa is a depression in the bone, and this is the depression that the mandible fits into. If we remove the mandible and turn the skull so that you see the inferior, you could see that this would be a depression. Again, let's look at the lateral view of the skull. You see part of the temporal bone extends anteriorly This part of the bone that extends anteriorly and ends at this suture is called the zygomatic process of the temporal bone. This zygomatic process is part of the zygomatic arch. Again, if we look at it from the inferior, you can see that we have this arch-shaped structure, the zygomatic arch. The next structures we'll see if we remove the top of the skull. We will take this flexible pipe cleaner to show you the foramen that you will find in the temporal bone. The first foramen is this foramen, this opening into the temporal bone. This opening is called the carotid foramen. If we turn the skull over, we can see where the carotid foramen comes out the other side of the skull. The next hole is the jugular foramen. And again, if we turn the skull over, you can see where this will exit the other side. The last structure is a structure you will only see in the interior of the skull. It is this structure right here. This is called the internal auditory meatus. We have one on this side of the skull and another on this side of the skull. The occipital bone is this large bone that we see on the posterior of the skull. The most obvious feature of the occipital bone is this large hole that we see for the spinal cord into the skull. This large hole is called the foramen magnum. On the anterior side, on either side of the foramen magnum, you will find these protrusions of bones that are smooth and rounded. These smooth, rounded protrusions of bones are called the occipital condyles. The occipital condyles make a joint with the first cervical vertebra. On the underside of the occipital condyles, you will see a hole right here. This hole is called the hypoglossal foramen. The sphenoid bone is best seen in the interior of the skull. It makes up this large wedge-shaped portion in the center of the skull. Many people say that the sphenoid bone looks like a bat or a bird or a butterfly. All of these creatures have wings, and so does the sphenoid bone. The greater wing of the sphenoid bone is this part of the sphenoid bone that you find in the floor of the skull. In the center of the sphenoid bone, in this area here, we find the sella turcica. The sella turcica has a large depression in the center of it. The sella turcica means Turkish saddle, and this particular structure will have a rider in it. In this case, it's the pituitary gland. You will also find holes in the sphenoid bone. The first hole is located on either side of the sella turcica, pointing anteriorly. It is a perfectly round hole. This hole is called the optic foramen. Again, if we turn the skull over and look at it from an anterior view, you can see where the pipe cleaner comes out. To the lateral side of the optic foramen, you will find the superior orbital fissure. The superior orbital fissure is an irregularly shaped hole. Again, we can see this if we turn our skull over. You can see it comes out on the inside. The next hole is this one. This hole is called the foramen ovale. It is an oval-shaped hole that goes through the floor of the skull. Again, if we turn our skull over, you will see that it comes out the other side. The last hole is found right here. This hole is called the foramen rotundum. The foramen rotundum, when you put something in there, it doesn't come out as far as you would think. It comes out underneath the skull like this. The sphenoid bone, like the frontal bone, also has hollow space in the inside of the bone. This hollow space is called the sphenoid sinus. The sphenoid sinus cannot be seen on this skull. The next bone is the ethmoid bone. In the interior of the skull, you see the ethmoid bone right here. If you look at the anterior of the skull, you can also see some of the ethmoid bone coming out into the nasal cavity. In the interior of the skull, you will find this structure of the ethmoid bone called the crista galli. The crista galli is a crest of bone that you see in the center of the ethmoid bone. On either side of the crista galli, you see this depression called the cribriform plate. The cribriform plate has many small holes punched into it. Those small holes are called the olfactory foramina. It allows nerves from the olfactory nerve to go down into the nasal cavity. The perpendicular plate is this vertical piece of bone that you find in the center of the nasal cavity. It makes up 1/2 of what we call the nasal septum. On either side of the perpendicular plate, you see these protrusions of bones on the lateral sides of the nasal cavity. These protrusions of bones are called the middle nasal concha. The ethmoid bone, like the sphenoid bone and the frontal bone, is also hollow in the center. The hollow center of the bone is called the ethmoid sinus. Again, you cannot see the ethmoid sinus on this skull. In the nasal cavity, you can also see the vomer. The vomer is this blade-shaped bone that makes up the other part of the nasal septum. The nasal bones are located here, making up the bridge of the nose. The maxilla is the upper jaw region of the skull. In the maxilla, you will find the upper teeth. If we look at the inferior view of the maxilla, you will see part of the maxilla that protrudes to the posterior. This particular part of the maxilla is called the palatine process. The palatine process makes up the anterior 2/3 of the hard palate found at the roof of your mouth. The maxilla is also hollow in the inside. The hollow spaces in the maxilla are called the maxillary sinuses. And again, you cannot see those on this skull. The sockets for all the teeth are called alveolar processes. The posterior 1/3 of the hard palate is called the palatine bone. And we can see the division between the palatine process and the palatine bone in this suture. The palatine bone is a U-shaped bone, and what you see here is the bottom of the U. The arms of the U extend into the skull. On the lateral sides of the skull you see the zygomatic bone in the cheek area of the skull. The zygomatic bone has one structure that we're interested in. It is the second half of the zygomatic arch. This portion of the zygomatic bone that projects posteriorly towards the temporal bone is called the temporal process of the zygomatic bone. The lacrimal bone is located in this area. See the sutures right here. You will see this hole in the lacrimal bone going down into the nasal cavity. Again, if we look into the nasal cavity, we will see one more pair of projections from the lateral side of the nasal cavity. These projections are called the inferior nasal concha. They are a separate bone from the ethmoid and the maxilla. The mandible. Like the maxilla, the mandible has teeth. Like the maxilla, the sockets for the teeth in the mandible are also called alveolar processes. This section of the mandible that projects superiorly is called the ramus. There are two projections that come off of the ramus, one to the posterior and one to the anterior. The posterior projection coming off of the ramus is called the condylar process. This is the part that makes up the temporal mandibular joint with the temporal bone. The second part is called the coronoid process. If we look at the mandible and look now on the medial side of the ramus, we see this opening. This opening is called the mandibular foramen. On the anterior of the mandible, we see these two openings here and here. These openings are called the mental foramen. Within the temporal bone, there are three tiny bones. These three tiny bones are the ossicles. The first of the tiny bones is called the malleus. The second is the incus. And the third is the stapes. The fetal skull has all the same bones as an adult skull. The only difference between a fetal skull and an adult skull is that the sutures or the joints between the bones have not fully formed. You will still see some soft spots or fontanelles between the bones. On the superior of the skull, you will see the anterior or frontal fontanelle. On the side of the skull, you will see the anterolateral or sphenoid fontanelle. Here is the posterolateral or mastoid fontanelle.